Another breast biopsy here. You can see a large duct, and inside of it is an epithelial proliferative lesion. Perhaps you could see a couple of small cysts in the wall or at the periphery of the duct. Perhaps you could see some fat tissue out here. And I bet you if we go along here, you may even see some normal breast tissue. Perhaps some ducts at least. I don't really see any classical acini. Notice that this big proliferated lesion within the ducts has a papillary configuration in that the epithelium seems to be lining these fingers of connective tissue. Also notice that they are stopped dead by the wall of the large duct that they're in, and they do not infiltrate into or beyond the wall. This is a classical breast papilloma. Breast papillomas are benign proliferation of ductal epithelium in which the proliferation is such that not only the epithelium proliferates, but the little core of fibrous tissue does as well. Breast papillomas are always extremely scary lesions for pathologists because cytologically these cells can look very, very nasty and malignant. So that's why Dr. Hagenson, in his Bible of breast pathology, always stresses that one should never, ever, ever diagnose a papillary carcinoma on frozen section, because I know too many pathologists personally who did, and they wound up being wrong, and some of them had to pay for it dearly, because that means the woman is going to be losing her breast unnecessarily. This is a benign papilloma of the breast. Even though the nuclei here look fairly uniform, they don't look terribly large or bizarre or necrotic in any way. You can see a tremendous amount of atypia in here, and it still is benign, especially if you are in a subareolar location. You would swear the epithelium is malignant looking, but it would stay nice and confined as a papilloma should do, because if a papilloma doesn't stay confined and it invades through the duct that it's in, it can then officially inherit the name papillary carcinoma. Also notice there is no necrosis within this papilloma either. Thank you very much.